In this video, we're going to be talking specifically about knee pain, what the cause of it is, and how to help release that. But we're actually going to be talking a little bit more specifically about the meniscus. So if you have any issues or past injuries with the meniscus, we're going to show you a position that you can do to actually help with the fascia decompression, and then an exercise to help strengthen this action to really stabilize the knee joint.
So Quinn, I'm just going to get you to stand up first. And we're just going to talk first about the alignment that actually causes meniscal issues and tears and what we can do to really support proper foundation. So first of all, the medial meniscus, the inside part of the knee, right here, right in the center, right where the knee bends, that's the medial joint line. And inside there is the cartilage, the meniscus, that is on both bones here, and it's designed for support and compression, and there's supposed to be space between that area. But when we hyperextend at the knees and we shift our weight so that we have more weight on one leg than the other, it creates a rotation and it takes away space in that joint, causing a wearing of that cartilage. And then we can even develop tears over time. And that can be very painful. It can even cause the knee to lock. So we want to really pay attention to our alignment all the time, because we are like a building and we always want to support proper cellular alignment. So what we want to do is we want to make sure that the feet are directly below the hip joints. And notice where Quinn's hands are. The hip joints are inside the pelvis. They're not out here. So you want your feet hip distance apart. You want to have those knees slightly bent. As soon as we hyperextend at the knees, now we're creating that rotation in that joint and we're creating the opportunity for that meniscus to wear down and potentially tear. We also want to make sure that the knee cap is directly over top of the second toe. This takes some time to train proper alignment, but do this in front of the mirror and you'll notice as soon as you hyperextend the knees, your kneecap and your foot are going to be in very different positions. So it's a process of understanding when those knees are slightly bent, how to align the toes. And then we want to root, that squeezing of the anus action that helps to bring our center of gravity back onto the heel. If we don't do that, we have too much pressure in the front of the foot, which adds a ton of pressure in the knee joint. So once you get into that alignment, a great exercise to do is to grip the toes, which helps lift and support the arch to create a nice strong foot that's properly aligned. And you want to do this for 10 full breaths. We want to take our time and really cement this action into the lower body. How does that feel, Quinn?
No, it feels very good. Yeah, so we talked about more of the plantar fasciitis, the bottom of the foot, and how to grip the feet in the previous video. So again, all we're doing is pulling the toes and we're trying to almost shorten this area to create more of an arch, but we want to decompress the fascia in the foot in that previous video, but now we're going to be working in fascia decompression right in the medial aspect of the knee, and then you want to start training that proper alignment.
So let's get into position. You can use a rolled up towel, and I think we should show people using our real tool.
Yeah, so all we're going to do to get into this position is lay flat on your front, and then whatever knee you're wanting to work on, kick it out to the side like this. This is actually a little bit more of a confusing position to get into. Once you kick this leg out to the side, you're going to bring your towel. If you have a block, awesome. If you have something similar, great. Directly underneath. I'm going to quickly swap this for our tool, the block, and I'm going to turn it on the side here. And then once we're in position like this, we want to rotate so that the front of our body is facing the floor, and then try to have your foot rested on the floor as well. You can start to create leverage that Deanna will guide us through to bring a little bit more pressure into this area, and then you can lay down flat on the floor if you would like.
And the nice thing is when you're laying on the floor, you can use the floor to breathe into the floor to really optimize your diaphragmatic breath. That's how we really get the body heated so we can send blood and oxygen flow to the area. And you can also use a book here. But what is also something you can do is taking your thumb. If you have a meniscal tear, just putting pressure with your thumb along that joint line is going to be painful. And then like the block, we want to hold. So whether you're using your hand, you're using a block or some other prop, a towel, even a hardcover book, Anything like this is going to help to melt through those adhesions if we do it over time. You can't just do this for a couple of seconds and have it really have an effect. We need to hold for a minimum of 3 minutes. So if your finger starts to fatigue, you can use your other hand, you can use different fingers, but it's all about that pressure over time so that we can get to those adhesions, pump blood and oxygen flow into that space, and then combining that with that training of proper alignment helps to create a release and an improvement overall. You want to come up and out now, Quinn?
Right. Whenever we're getting out of position, hands under the shoulders, always make sure you exhale as you come up and out.
And of course, when we're dealing with any body part, we can't just simply focus on the area of pain. There's cause sites all over the place. So again, in block therapy, we address that, but this is a simple thing that you can do in the moment to really get a sense of how this works.
Totally, and to give you some relief as well. So hope you enjoyed the video. Hope this was helpful. If you have any questions or comments, leave them below. If you liked it, give it a thumbs up, and then make sure to subscribe to Block Therapy YouTube channel, and then hit the bell if you want to get notified every time we upload a video very similar to this. So we'll see you in the next video.